Hello, my name is Rasheedat, Gidado.
I'm Victoria.
I'm Abby, and we're part of the SNHS chapter of Colonial Forge.
Today we're going to be talking about facial transplantation. So trigger warning, there's going to be some images of facial transplantation. So if you're squeamish, click away. Yes, here we go. Okay, so what makes facial transplantation so special, and why is it so dicey? So unlike other organ transplants, a full or partial facial transplantation is classified as a vascularized composite allograft, or VCA. So this means that multiple structures, including bones, skin, nerves, connective tissue, muscles, and blood vessels, are transplanted all at the same time. This means surgeons must prepare every single cut facial nerve ending and maintain perfect bone alignment with the recipient and donor, and avoid sensitive areas like the eyeballs and airways. The challenge of the procedure itself already ranks facial transplantation as one of the most invasive surgeries, but months of planning, drills, simulations are also required. So let me ask the viewers a question. If your siblings or parents had just died, would you be willing to have their face cut and donated to be transplanted? Comment down below if you would or nah. So I'm guessing you said nah. So finding a donor is super difficult. An ideal donor must match in skin tone, bone and muscle structure, blood type, and have a specialized VCA authorization from the recently deceased donor's family to be able to transplant their face. All these factors combined create an immense obstacle towards the success of a full facial transplantation.
Okay. And this is the procedure.
The face transplant began with procurement of the donor facial tissue, including the midface, mandible, associated teeth, and the overlying soft tissues. The incision extended from the lateral face inferiorly and was carried out anteriorly below the eyelids, above the nose, and around the neck to the contralateral face. The zygomatic, buccal, and mandibular branches of the facial nerve were identified and divided. Adequate exposure was performed to allow completion of the skeletal osteotomies. Custom-designed 3D printed skeletal cutting guides were fixated into position based on the preoperative surgical plan. Following completion of the zygomatic, nasofrontal, and bilateral mandibular osteotomies, the neck vessels, including the internal jugular veins, external jugular veins, anterior jugular veins, internal carotid arteries, and external carotid arteries, were identified and circumferentially dissected. Final liberation of the donor facial allograft was performed following ligation and division of the major vascular pedicles perfusing the allograft. Concurrently, the recipient's surgical procedure progressed to create a defect for precise adaptation of the donor facial allograft. Comparable incisions were performed in the recipient. This allowed the removal of all external scar tissue throughout the face and neck. All pre-existing hardware was removed prior to face transplantation, and the orbital floors were reconstructed bilaterally using prefabricated titanium mesh. Recipient craniofacial scanning and registration were performed using intraoperative surgical navigation to allow accurate facial allograft inset. Similar to the donor procedure, prefabricated 3D printed cutting guides were fixed into position based on the preoperative surgical plan. This allowed completion of the right zygomatic, nasofrontal, left zygomatic, and bilateral mandibular osteotomies. The resultant recipient facial defect was complementary to the procured donor facial allograft. This allowed precise inset of the donor skeletal segments and overlying soft tissues, as well as coaptations of facial nerve branches and vascular anastomoses. Accurate midface skeletal alignment was ensured. In addition to optimal mandibular contour, rigid fixation of the midface was performed using titanium plates, and bicortical lag screws were used for mandibular fixation. The remainder of the facial allograft was then tailored to resurface the entire recipient defect and achieve final soft tissue inset.
On to the history of face transplantation. It was first mentioned in 16 BC by an Egyptian medical text called the Edwin Smith. It was in 1994. It was the first face replant on a 9-year-old, and then in 2004, the Cleveland Clinic approved of the surgery in the U.S., and then in 2010, a man named identified as Oscar, was the first to receive a full facial transplant. Some cases of face transplantation. So the first replant was on this young child. She had her face and her scalp ripped in 2 pieces when her hair was caught in a grass cutting machine. And then the first partial face transplant was in 2005 on a young girl because her dog gnawed off her face to wake her up from an overdose. And then the first full transplantation was on a man identified as Oscar, and he received the first full transplant after he accidentally shot himself.
There are ethical questions surrounding face transplantation, though it is an amazing discovery that can help burn victims, people who have facial cancer, and other possible candidates. The speculations also have a big role in figuring out if the procedure is ethical in terms that differ from just helping the patient out. One issue lies in the topic of the donor, and many people wonder where faces for these procedures come from. They come from people who are medically considered brain dead. And is it really right to perform the procedure at the expense of someone else's face? And the patients go through psychological changes in response to wearing someone else's face. Also, there are some speculations surrounding how face transplantation candidates are chosen. Is money a big factor that limits some people from receiving the procedure? Medications like immunosuppressants is something that the patient must take in order for their body to not to reject the transplanted organ, but without the funds, they may be excluded from being a transplantation candidate.
And this is our works cited. Okay, 1, 2, 3. Make sure to smash that like button and hit the subscribe. Bye.